I'm Dr. Kim Yong-jin. Recently, the big trend in the dentistry would be the digital dentistry. Digital dentistry is a big hot topic in the dentistry. I believe many of you are digitalizing your clinic for the last several years, and digital guided implant surgery is something we can easily access. The result of digital guided surgery is believed to have a very good and dramatic results, but if you do not understand the principles of digital guided surgery, you will encounter complications and a not so satisfactory outcome. So in this lecture, let's have a look at the overall workflow of digital guided surgery. I always ask a question when I throw a digital guided surgery lecture. Why do we need to place implants accurately? What is the definition of accurate implant placement? It would be in proper position and angulation when implants are placed. So for ideal prosthesis with long-term stability, we need to place implants in accurate position and angulation. But clinically, we encounter various limitations due to mouth opening, for example, of a patient, or poor visibility during surgery, so they are not placed properly. If two implants are placed too close with each other, interproximal bone loss would occur, and in the upper anterior, papilla loss, which is more tragic in terms of aesthetics, can occur. Or in the posterior region, patients' capability to self-cleansing is difficult due to lack of space. So in short, it is unfavorable in biomechanics. When implants are not properly positioned, long cantilever can occur. The bending moment of the cantilever can cause a fracture or loosening of an implant abutment or screw, and it can lead to complications aesthetically in the anterior region. Many doctors say CAD/CAM abutment or custom abutment can overcome the problem of malpositioned implants. Of course, the prosthesis can be fabricated for that purpose. However, it would be very difficult for the patient to maintain the oral hygiene, lowering the long-term stability of an implant. Number 16 and 17, two implants are placed in our hospital as the patient was referred to us, and other implants were placed in other dental clinics. You can see gingival swelling and bleeding as complained by the patient, and whenever the complaint came, we did the maintenance care. But when a case has a bone loss like this, the maintenance supportive periodontal treatment may not have very good response, and the patient wanted to remove the prosthesis and have new prosthesis, so we decided to remove the prosthesis and to check the positions of implant. On the panorama, mesiodistal positions can be confirmed, but buccolingual positions cannot be confirmed. So first, the prosthesis is removed in the left side of the upper jaw. We found the screw access holes are buccally positioned. Based on the screw access hole, we can estimate the positions of implants. So this is the case where implants are too buccally positioned. Therefore, to compensate for the malpositioned implants, gold cast abutments were fabricated, but excessive cantilever is made palatally. Below the palatally extended cantilever, plaque control was not possible, so gingiva in that area is inflamed. Keeping those implants, replacing the prosthesis would not work here, so the implants were removed and new ones would be placed. A flap is raised and implants were removed using a fixture remover. In the upper posterior region, fixture driver can be used. If it is not easy, EFR kit can be used. But fortunately, in this patient, we could use the implant driver included in the conventional taper kit. We used it in the reverse direction and implants were removed. Drilling was done palatally to correct mesiodistally malpositioned implants and new ones were placed. After that, at the buccal side of 24, wide bone loss defect exists. So for ideal bone support, os builder is used for GBR. After that, this is post-op panorama. This is the panorama after the delivery of final prosthesis, PA. Let's compare. On the left, existing implants before they were removed. On the right, newly placed implants. If you place them in ideal position and in ideal placement depth, emergence profile would become very good and the patient can maintain the oral hygiene very well and the shape of the prosthesis can be made for favorable oral hygiene maintenance. So the case was successfully treated. Like this, how can we place implants properly? In the analog way, implant surgical guide was fabricated. Impression is taken from a patient and stone model is made. On it, artificial teeth are aligned or wax up is done. An appliance is made using vacuum foaming matrix like making OmniVac and drilling holes are created for ideal positions only. The holes are designed for ideal positions, but with the analog style conventional surgical guide, there's no dedicated drilling tools. In other words, there's no dedicated tools to induce accurate drilling through the holes, so conventional drills would be used, but the size of the guide hole would be bigger than the first twist drill, which is 2.0. So during drilling, ideal angulation cannot be controlled. When a patient cannot open mouth widely, it can go in a different direction. For full depth drilling, the handpiece can easily go distally. Like this, it can damage the root of adjacent tooth despite using surgical template. So among the surgical guides, vacuum formed matrix, the analog style surgical guide doesn't help in controlling the angulation. Therefore, recently, as the digital becomes the big trend in dentistry, digital surgical guide, digital guided implant surgery is getting very popular. In the modern digital guided implant surgery, CBCT is the biggest contributor to that. With the widespread use of cone beam CT, digital guided surgery is enabled. But taking CT alone cannot make guided surgery possible. The teeth and bone data, the three-dimensional data acquired from CT, is used by the software allowing virtual implant placement. So using the CT data, implant planning can be done. So ideal implant planning can be done in a virtual way. That is thanks to the use of CAD programs. However, even though we do excellent planning, there is one more limitation. Anybody can do planning properly. However, we need to transfer accurately the planned implant positions into oral situation. As you can see here, even though the picture is presented, depending on the skill and technique of a surgeon, it cannot be transferred in the outcome. Therefore, We need one more device that can stably transfer the planned implant positions and angulations to the oral cavity of a patient. That's why we need the surgical guide template. As 3D printing technology is becoming widely used and their accuracy has increased and they can use various materials and it has become cheaper in prices, so the surgical templates can easily be printed. One jet-like 3D printers can be used in a clinic to easily fabricate and print the guides. CAD, that is the virtual planning program, and 3D printers, the CAM technology can work together, enabling stable digital guided implant surgery. As you know, guided surgery can give very accurate outcome. Anybody can do it. This is a trial done in the Shanghai, the 9th People's Hospital. This implant program was used. In one group, only planning is done, and the skilled doctors place the implants referring to the planning, and on the other group, various guides are fabricated and used to transfer the planned positions to patient's mouth. The same surgeon placed more accurately using the guide as shown by this trial. Also, from the perspective of a patient, the guided surgery allows a flapless approach, which can prevent post-operative swelling and pain, reducing the discomfort of a patient. So, the guided implant surgery can be used from simple cases if you are a beginner to complex cases if you are a skilled doctors. In order to do guided surgery properly, we need to understand the guided surgery principles and workflow. The workflow is as follows. Let's have a look at it in more details. The first step is to take the cone beam CT. By taking the CT, we get the information, the three-dimensional information about bone, teeth, mandibular canal, and the distance to the sinus. Therefore, ideal implant planning without complications can be made. However, we need one more data. The guide will be put over soft tissue gingiva and adjacent teeth, so we need surface data. Trios, like intraoral scanner, can be used to get the surface, like teeth and gingiva. I use trios. I take CT, adjacent teeth, and gingiva is not represented in the CT, so I use the intraoral scanner to get that information. If you do not have trios, a model can be fabricated in a conventional way. Silicone impression can be taken, and using a model scanning can be done. This is not a bad idea. So, DICOM file from CT and the three-dimensional STL file from intraoral scanner should be merged together. Before planning, this is the most critical part, which is merging. CBCT DICOM file and the surface file STL file need to be merged. This is the merging procedure. The merging is done based on teeth. If you use one guide, Implant Studio from 3Shape can be used. The appearance of teeth on the CT image and the teeth image from the surface data can be superimposed. The surface scanned data is used to design prosthesis. Relation to opposing teeth and the relation to adjacent teeth are considered to design prosthesis. After that, to support the prosthesis, ideal positions of implant placement is identified, enabling top-down approach. In other words, restoration-driven implant placement. If you look at this case, which is my case, in the upper anterior region, one guide is used to place implants. This is planning. Motor scan data and CBCT scan are superimposed based on the appearance of teeth, and they are merged. The model scanned data on the surface data, the size of a tooth angulation would be adjusted. Prosthesis design is done first, followed by implant insertion on the CT data. On the CBCT data that is done, what we can estimate is the screw access hole, whether it will be positioned in the labial side or palatal side. After placement, the buccal wall thickness of residual bone can be estimated after confirming the implant positions. To place implants in those areas, guide holes are designed, and surgical template has additional information to support the accurate guide holes. In other words, the key to the surgical template is the guide holes. The planned implant positions angulation can be facilitated by the guide holes, and the surgical template has additional information to support the guide holes. The guide is designed in this way. In the implant studio, it is designed. The designed guide's STL file is extracted and printed using a 3D printer. One guide template would be completed in this way, and the one guide template would be sent to your clinic, or if you have a 3D printer, you can print it directly yourself. So digital guided surgery is widely used. Many implant companies develop and make available the guide systems for users to use their implants. However, each company has different pros and cons when it comes to the digital guided templates. The guide holes size and systems used would be different from company to company, and you need to understand the differences to do digital guided surgery properly. We looked at overall digital guided implant surgery workflow. When we understand the workflow accurately, we can reduce the errors to the minimum from the beginning. The market of digital dentistry is huge and evolving quite rapidly. The biggest advantage of using digital guided implant surgery is to do various implant planning with three-dimensional bone and teeth data from CT data and infraoral scanner or model scanner surface information. In the past, we just took a CT image and applied a template to estimate where the positions should be. However, now even prosthetic design can be done, and overall treatment outcome can also be estimated. That is the big advantage. However, digital guided implant surgery cannot be applied blindly. Many challenging outcomes can occur. Therefore, the most basic workflow should be understood. Based on that workflow, we will talk about one guided system's characteristics and detailed information about kits. Thank you for your attention.